Thank you for joining us here on ABC 24 Plus. I'm Lauren Turman. Yesterday, Judge Cheryl Lippman sentenced Dr. Sanjeev Kumar to 20 years in federal prison and 2 years of supervised release after he was convicted on charges related to using adulterated medical devices and healthcare fraud. Between September of 2019 and April of 2024, Kumar performed more than 15,000 procedures using these devices. And joining me now is two of Dr. Kumar's former patients. We have Quita Weary right here and Corinne Oliver. Ladies, thank you so much for joining me today. I know this is a really tough topic for you both. Quita, starting with you, I would love to ask about when you initially started seeing Dr. Kumar and the types of procedures that you have gone under him.
I went to go see him February, March of 2024. And I had biopsies done, several biopsies done. I had ultrasounds done, and then it led to where I had a hysterectomy.
Okay. And Corinne, I know we've talked quite a bit before about your experience, but can you tell us about your background with Dr. Kumar?
Yes, I actually just went for an annual checkup for an older woman, and I went to Dr. Velaswamy, and he tried to do 2 biopsies, and the first one he said he couldn't get any tissue. Then he had me to come back in 10 days and try it again. And then he told me, oh, he was gonna have to send me to this doctor, so he sent me to Kumar. I was kind of just wasn't thinking, I'm just actually trying to get, an annual checkup for a 68-year-old woman. And when I went in there, the first day, he never did like a progress note on me or anything like that, just put me on the table. And first he had a medical assistant and I believe a nurse practitioner in there. And I just basically said that I wanted the doctor, my first visit. So he came in. In the meantime, I was looking around the office and I saw the plastic containers with forceps in there. I asked I believe she was the medical assistant, I asked her, was those sterile? Because she had them up to use on me. And she said, oh, yeah. And I got a little nervous because I know sterile equipment is just not sitting in a plastic container. And when he came in, I tried to question him about what was he going to do, what's going on. And only thing he can say, I take care of you, I take care of you. And it was very frustrating. So usually when you go to the doctor, you really trust the doctor and their decision. So I was trusting that he was going to do the right thing. And then he had me come back 1 week later, then 2 weeks later, then 2 weeks later, just had me coming. And he kept doing these biopsies, and it was very painful and bleeding. And I've had biopsies before, and those were very traumatic. It should not have been that painful. And I would go back and tell my medical doctor, my internal medicine doctor, something is wrong here, And she tried to help me one time. She sent me to Dr. Flynn to get a ultrasound, because he started saying, oh, a lot of fibroids. I know I didn't have a problem with fibroids, maybe in my 20s, but not in my 60s, And I said, well, no, I went to Dr. Flynn's office and they said that I didn't have a lot of fibroids. And the only thing he could say is a lot of fibroids, regardless of what I was saying. And so I started getting like a little confused. Well, somebody wrong here, and you kind of always follow the doctor, thinking they're correct, But after a while, I started, I went to wash my hair, and I put shampoo in my hair, and my head was on fire. I didn't know what was going on. And when I looked in the top of my head, I had like a rash or blisters all in the top of my head. Then I started getting concerned because my doctor started sending me to different doctors and it wouldn't get better. I went to several dermatologists. And then after that, I started got to the point where I could not eat any food, period. I went to several doctors behind that, oncologists. They were trying everything, doing procedures, and I was constantly losing weight. And I got down so little that I could barely even walk. I couldn't go anywhere. I couldn't fit into my clothes. I could go out with somebody to eat, and the food was just there. I had to throw it away because I could not eat, period. I tried to sip on water, and I would get choked. The water would choke me. Another doctor told me to sip on some freeze, those little freeze things. And I tried that. I couldn't keep that down. And like I said, I had 2 or 3 different procedures, you know, check my stomach, checks whatever. And everybody kept saying unexplained. They didn't know what was happening. All of these professional doctors kept saying unexplained, mystery. And I got so little and so skinny, I really thought I was going to die. I was starting to prepare for my funeral, you know. I was getting everything in order. And it was horrible because I couldn't go anywhere. If I went anywhere, I had to take a big gray garbage can with me to vomit. And then it was very painful because I got to the point where I didn't have anything to throw up, you know, or just sort of like greenish stuff would come out. But I continued to lose weight, and what got so bad was 3 of the doctors, they got together and told me, you gotta eat, you know, and then they start blaming me, saying I was not eating because I was grieving over my sister's death. My sister had been deceased about 2 or 3 years, and I grieve over her death, but I'm not stupid not to eat for almost a year. That's crazy, you know. And why would I buy food when I couldn't eat it, you know? I tried, you know. Sure. And I did not discover until the FBI got in touch with me, and I finally looked at my records, and I saw he was giving me chemotherapy, which is used for women with breast cancer or young women trying to get pregnant. I wasn't trying to get pregnant, and I didn't have breast cancer. So the chemotherapy just basically ate up my body.
Wow.
And I still suffer now, you know.
And I can see, you know, it's very emotional for you telling that and recounting all of the things that you've had to go through since you saw Dr. Kumar. Quita, I also want to ask you, I know you talked a little bit about your history, but have you ever felt a time where you thought things may have been off with Dr. Kumar? Have you ever experienced any of the things that Corinne was just talking about?
Yes, so after the second biopsy that he did, when it came back, because my first reading was like a negative positive for cancer. So my second one, when it came back, it was negative. He proceeded to give me another ultrasound, and my uterus was cloudy. He gave me 2 rounds of hormone therapy pills to take. The second time, it didn't work. So he said, it is cancerous. My uterus was cancerous. So they will have to go in and do surgery, a hysterectomy. And so after my surgery, I began to have like problems with my bladder. I began to have like problems with my side hurting, my back hurting, the pain. It didn't go away. I don't know what happened during the procedure, my hysterectomy, but my left side, I have to use a walker now at times because it's hard for me to walk when it lock up on me. And so I have to use a walker now. My anxiety level is high, extremely high. And I'm just overwhelmed right now.
Sure.
And I've been through a lot with this doctor, and it's like he brushed me off. Every time I would go see him, he brushed me off like, oh, I'll give you some pain pills, or I told him I thought I had an infection. He would just say, oh, well, I'm just gonna write you a prescription for antibiotic, like he didn't care.
Wow. So I hear a lot of similar issues between both of you all as well. And I want to ask you more, of course, because between the time that you all have been visiting Dr. Kumar to when all of this happened, his trial, and of course yesterday his sentencing, I know it's been a really long journey for you both.
Yes,
So
it has.
Quita, I do want to start with you. I know you were in the room when that sentencing was being read. Can you just tell me a little bit more about how you were feeling and your thoughts as you were hearing all of it?
My heart just dropped to the bottom of my stomach. I feel disgusted. I feel that it's unjust and we wasn't heard. The judge allowed us to testify, you know, saying how we felt about it or whatever, but it's like she didn't care. She just brushed us off as well. The lawyers were kind of discriminating against us because the insurance that we have, it was just a lot. It was a lot.
Wow. And you, Corinne, I know you were also in there as well, and you were telling me about how emotional you got in there just hearing all of that. What were your immediate thoughts?
Chemotherapy can change you mentally and everything. And I just wasn't myself, and I don't know, I started screaming and yelling, jumped up and started screaming and yelling and crying, and they had to take me out of the room. I can't even remember what I said. I mean, I keep trying, I can't even remember. I was responding to something that the lawyer was saying about the pain that we were going through. He was saying something about maybe pain or something like that, like we were not in pain. And as much as I still suffer today, I was horrified and upset, and I can't even remember yelling and speaking and them taking me out of the courtroom. I can't even remember what I said, you know. And it's very traumatic. It's very traumatic, you know.
Sure. And you both mentioned something to the effect of feeling ignored. You know, you mentioned being taken out of the room. You also mentioned that you felt discriminated against kind of in the process of these things.
Yes.
And Corinne, I do want to start with you again about what you were hearing in terms of the trial. I know you all have been following that, and when it came to the sentencing as well, in what ways you really might have felt more ignored when it came to that process. I know there was testimony, as you mentioned, but what were your thoughts in terms of the way you were treated during the duration of this case?
I felt like I was treated like I was nothing. Like I'm not, like I didn't have any pain, that I didn't go through all of this misery that I went through and still go through. And I was very upset about it, because I understand you're a lawyer and everything, and I understand, and you're trying to defend someone, but to just act like nothing happened to us, that's crazy. And not just one person, thousands of us, I mean hundreds of us, you know? And to get up and act like we were nothing. If you get Medicare or Medicaid, you're poor, you're nothing. And that's not true, because Tennessee law said when you get a certain age, you have to have Medicare, you know. And to get up there and just act like we were nothing was horrifying. And I just literally just wanted to do something to that guy, and that's just not me. And I believe the chemotherapy, it still affects my body, my mental stability, and I just wanted him to know, I just wanted him to shut up and be quiet, because he did not know what he was saying. It was hurting everybody, you know.
And Quita, I know based on what you had also said about sitting in that room, initially, when the verdict came down, this was a man who was said to be potentially facing more than 100 years in prison. Of course, with the 20-year sentencing, I want to know, did this bring you any sense of peace? Do you feel like justice was served here?
No, it was not. No, it was not. For the things that he have done to us all, justice wasn't served.
Sure. And again, kind of going back, I do want to backtrack with you all about when you finish your care with Dr. Kumar. I know both of you have talked about the lasting effects, the lasting pain you all have been through. Corinne, I do want to start with you because I know your history is very complicated here. You talked about the FBI getting you therapy. because of all of the things that had transpired here. What does life look like for you after you ended with Dr. Kumar? Did you have to see more medical professionals?
I've seen at least about 15 different doctors. I've seen 3 different cancer doctors. I've had different procedures to my stomach, just trying to find out what was wrong with my stomach. I had a problem with them giving me medication. Then I had bowel incontinence, and then they gave me the medicine. I started having urine incontinence, and that's, my whole dignity and everything was destroyed, I'm not the person I am because of the medicine this doctor gave me,
And Quita, same question for you about how life has looked for you after you finished your treatment with Dr. Kumar.
The same medical doctors. I'm going to see different ones at the West Cancer Center. The problem has came back. There's still no findings of cancer, but the issue is still there. The pain is still there. I want answers. For as OBGYN, no doctor won't touch me after they find out that I've been to Dr. Kumar.
Yes.
Wow.
So it's...
So no one will see you now that they know that you've...
No GYN doctor.
Neither of you?
No.
Wow.
Yeah.
So where do you go from there then? Do you plead your case? Do you tell these doctors about the things that you've been through? And what does that look like for you?
I've told several doctors that I've been to the things I've been through with Dr. Kumar and how I felt I've been mistreated by him. They say, oh, I'm so sorry. They don't care. So I'm just alone.
Just feeling alone here. I also know that you all, throughout the course of this entire case, have connected with hundreds of women, I believe, who have experienced similar things here. What have they, and Corinne, I'll ask you first, what have they been telling you all about what they've been going through? Do you all seem to have experiences that align after seeing Dr. Kumar, or does it feel like you're hearing things and they're really the first time that you've heard something?
No, I listen to a lot of patients, people explain what they went through, which is horrible. A lot of them got basically about the same worst treatment, young girls having their organs removed and constantly saying that they had diseases that they did not have, and he still took their organs, did surgery on them just for money. And that's horrible. People lose their life, unable to bring people into the world, not able to continue living their life. And you just down like that's it, that's it. You can't, I have not been to an OBGYN doctor since the last time I went to him about 3.5 years ago. I don't want anyone to touch me, It's very, very emotional, and I don't feel safe anybody to do a vaginal exam on me or anything,
And Quita, with you, what have you been hearing from many of these women? Have you heard similar accounts?
Yes, I have. They all said that they had hysterectomies, unnecessary hysterectomy, that they all had a hysterectomy due to Dr. Kumar stating that they had cancer, and it wasn't true. Well, I think we only had one lady that said that she actually had cancer, and it was left untreated until stage, 4?
Yeah.
And Corinne, I also know, of course, like you said, with your complications, you've talked to me in the past about this toll that it's taken on you just being able to move around.
Yes.
Do you have a message for other people who have gone through this?
Yes, it took a lot of prayer for me to be able to accept what was going on. And I was in and out the hospital so many times. And one day I was in the hospital and this doctor who was reading my chart, which they didn't do, and he discovered that I was a patient of his. And he gradually spoke to me about it. And I told him, I can't talk about it. I don't talk to anybody about it. I'm fearful. I try to always take care of myself. I don't want anybody to know what I went through. And he told me, you talk about it. He said, it's best you talk about it to get through it, you know? And so I did. I started back going to the psychiatrist, and I started talking about it to people, you know, and it still don't feel any better. It still don't feel any better, you know? And it's a struggle. Every day it's a struggle for me because since then I've had heart conditions, been in the hospital for heart failure and kidney failure, shortness of breath, fluid, 25 pounds of fluid. And this is all because of the medicine that he gave me, which he never should have gave me. I did not have breast cancer. There was no reason for him to give me some chemotherapy that destroyed my body, you know.
And with you, Corinne, what are you hoping to get out of the support group?
Well, the first time I was interviewed by you guys, there were so many people. I can walk down the street and people know me. They know me from my interviews. And I can get hugs and everything from people. And I've had some people to say that we should do something to support ourselves. And at the time, mentally, I just could not do it. I could not focus on trying to help anybody. But now, we survive. We still struggle, but we survive. And I think we should start a group where all of us know that we got each other and we support each other. And hopefully some of these people that know me will have seen me, hope they can help us to start us a survivor group, you know, because we're never here, but we are surviving, you know, and that's what I want to start.
Corinne Oliver and Quita Weary, thank you both very much for joining me again, both former patients of Dr. Sanjeev Kumar. I know this is a really tough thing for both of you all to talk to us about, and I appreciate you both sharing your perspective. Thank you very much.
Thank you.
And thank you all for joining us here on 24+. We will have much more coverage on this.